and welcome to Haverin About, a father-daughter podcast all about healthcare technology and the business of selling into it. And today we have a very exciting guest. We have Andrew Tsang, who is one of Dad, you have a Substack bestie now.
Andrew's a very interesting writer. His style kind of caught my eye as I was reading through, and he's new like me. So I think he started writing and publishing about a month after me. And so we ended up being kind of like, emotional support animals for each other.
Well, this conversation was fascinating. We covered everything from just everything when it comes to healthcare. If you think about this 4.9
trillion with a
trillion dollar industry that we work in, how it goes from that 4.9 trillion all the way down to, as I mentioned in the podcast, a $22,000 a year janitor.
Mm-hmm.
And all of the loops and twists and turns and squeezes that it takes to get there. So I hope you all enjoy. As we said, Andrew is on Substack, as is Dad. And all of the links for everything that we discuss in today's program is in the description. As always, reviews, comments, likes, all of those good things always help us a lot in order to increase the reach of all the wonderful things that we talk about and share them with more and more people. And so with that said, please enjoy our special guest for today, Andrew Tsang.
The impetus for this conversation with Andrew today is actually one of his most recent articles, and I'll make sure that we put a link in the description and up here on the screen for you to be able to find that, particularly about what I'll call the macro of the healthcare business, i.e. what is the big landscape all the way up to the US economy level. Because I think understanding that and helps to inform you about where you sit inside the healthcare economy. So Andrew is going to sort of help us through with a little bit about that. So welcome, Andrew, and thank you very much for joining us today. I know you're a fan of the podcast, so thank you. You need to sort of be getting your merch on our store so that you can
you're gonna send me some swag.
You can really show your fandom.
All right. Yeah, thank you so much, Stuart, for having me on, and I'm so glad to join you and Bethany here. Yes, Stuart and I, Substack, besties. And I really do appreciate you for that, because that's kind of where my heart is right now. Like, my mind and my business is on like LinkedIn, where you can find me as well. But where my heart, where I started to write, was on Substack. And Stuart has been an immediate supporter, and with your support, feeling very inspired to continue to research, share my perspectives, and discuss a lot of things about healthcare. So maybe I'll start even there, kind of where I'm at in the end here. I started doing a lot of research and write-ups on like long-form essays. Like, who reads that anymore, right? But I wanted to do that because based on my experience as a healthcare consultant across, provider, payer, pharma, even a little bit of like policy experience, and really trying to demystify and clarify some of the complexity around healthcare. And I think more important than all of the technical jargon and the economic and all that stuff, I think there's like a heart to it. So the way that I've always wanted to do that, and I get back to the idea of my heart being on Substack, is trying to make it relevant to people. And I think that's really the most important thing in an industry that really is fundamentally about lives and people. And, obviously there's a lot of money and politics and, very tough things about it. But I think we need to understand all of it together in order to make it a more successful system.
Well, I think that's one where, and maybe even if you see the title of this podcast, you're like, economics, macroeconomics, right? Like, I had to take an econ class in high school. I don't want to think about that again. And with everything going on right now politically, it's a very easy time to put your head in the sand and be like, nope, not interested. And for certain things, that's fine. If you need to do that to get through the day, you do you. But if you are in healthcare technology, if you are selling in healthcare technology to these CFOs and these buyers who their hospitals are going to live or die based on what is going on a macro level, you do have to be aware of it. You do have to kind of understand, where does the money come from that you're trying to get a little slice of the pie out for your SaaS solution, your AI thing, your whatever it is that you're trying to sell, your little slice of the pie, where does that come from? It's so important to understand that.
Yeah. And I think that was one of the reasons I did an article which I called The Knights Who Say No, which was really advising people, to sort of like think about as they get their fan, their sponsor inside an organization, be it a physician or a business department manager, whoever it might be, that there is still a lot of hurdles to cross internally to try and get consensus, because healthcare organizations are very consensus driven. But I then wrote a follow-up called the Pauper CFO, which is even once you get past all of those gatekeeper type people, you can still get to the CFO and he goes, yes, a great idea. Yes, an awesome return or impact assessment in terms of, what the outcome could be. Guess what? I have no money. I just don't have any money. Sorry. Because this happened, that happened, the other happened. And I think that's what we're here to talk about today. I saw an article in Beckers today where the AHA is actually suing the federal government because of changes that they're proposing to the 340B reimbursements, which effectively, it helps a lot of the smaller rural critical access hospitals be able to recover monies related to pharmaceuticals that they might dispense to patients as they're being discharged from hospital so they can continue that course of treatment. And that was the original intent. It's become way more complex than that. And so the federal government is trying to kind of like correct it a little bit. And of course, in that correction, it's upsetting the apple cart. And that may seem completely irrelevant to you selling your little medical device or your consulting services for whatever it might be. But for that CFO, potentially they're about to lose 1 to 2% of margin off their bottom line because those reimbursements are suddenly going to be held up. And how does he deal with that as a cash flow issue or even potentially a loss of revenue issue? So I think that's why it's so important to understand this big picture that we're about to go into. So now I've plugged my Substack. Why don't you tell us a little bit about the analysis you did and the genesis for you creating this article? Because it is absolutely fascinating. The methodology you use to try and illustrate to people what is. Well, I'll let you describe it.
Yeah. I mean, well, first of all, I enjoyed your article, and that's how I knew it is a kindred spirit, because I agree. When you're inside the walls of a health system, it's completely different. You're inside the castle, right? To Bethany's point too, it's very easy to be so caught up in just like palace intrigue or whatever. It's hard to understand the macro scale, the fiefdoms and the kingdoms outside the castle. And one thing that really draws me to it, having been a consultant, I've been in a lot of different castles, right? I might be on one side of the fence in a provider organization trying to maximize billing, right? And let's get more revenue. And then I might go to the payer and then like figure out ways to do utilization management and cost containment. So for me, just as a personal effect, it felt like, man, I'm just like pushing the boulder one way and pushing it another way. Yeah. I'm like, what is everybody doing here? And I could feel a lot of people in healthcare probably have a similar sense, right? Like, what is the contribution here? And as I was thinking through that and developing my kind of soul-searching writing, I decided to kind of map out some of these things, right? One, I really looked at one thing at a time. Like initially, maybe I started looking at how does employer money go to like the hospitals? Mm-hmm. Maybe I looked at how different government programs then ultimately provide funding for health systems for like safety net funding and different things like that. And all the cross-subsidization economic mechanisms behind that, but that's boring stuff. Anyways, really what I wanted to do was take all that really complex stuff and then like put it into like a really clear way. Well, the funny thing about the US healthcare system is it's obviously not clear. And in the illustration that I ended up doing, it's painfully so. So just to talk a real quick thing about my methodology, and won't bore you with the facts, but I made this thing and I looked at it and I was like, what is this thing? It's so tangled up. It looked really like a knot, and that really summed up US healthcare well. So then I ended up looking at some other countries to see how other people do it a little bit. And it's so much more clear and simple. Like the UK is a lot more direct in how they have a single NHS with some private insurance. Germany and, their namesake of the Bismarck model has really an efficient German model as well. Although it is quite complex as well too, because you have to pay attention that they've got like 100 something different insurance companies. Is kind of a big burden there too. But in the end, it was all better than what we have in the US. And that's really what I was trying to illustrate.
I think it's interesting that you said after, I think we're probably of a similar generation, similar age. I think when a lot of people have entered health tech as 22, 23-year-old, optimistic 20-somethings, I have noticed a lot of people when they hit that kind of 10-year mark, pause and either stay with it and they keep going, but they do kind of have that, this has all been interesting, or they just leave. I've had a lot of friends who have left in the last few years who have gone to other industries because they're like, this is too
hard.
It's too hard. It's too complex, and it's only getting more and more complex by day. So it's interesting that somebody else had that kind of,
and I think that
after a decade or so, like,
that's also true
life crisis.
of a lot of very large corporations. If you look at the history, thankfully, with this gray hair, I've seen a lot of stuff. And one of the things that becomes very apparent is the number of like mega corporations who go, we can crack healthcare. We've got all these other industries we're doing. Healthcare, this is going to be a piece of cake. And they come in and it's like, I've watched several, like McDonnell Douglas back in the day. Sort of like IBM has been in and out of healthcare in various ways, not just as an IT provider, et cetera, but trying to sort of like come in a much grander way, like 3 times in my career. And what happens is a bit like, what they did with Watson Health, in and out in 3-4 years, because they come in with a grand plan. They're really excited. They make big investments. They make acquisitions. And then suddenly they realize this is hard. And they suddenly sort of like fall out of love with it and back off. But Andrew, I'm curious about the lessons that you drew from your own experience once you actually saw the diagram and went, aha.
Yeah. I mean, that was the one thing that I struggled the most with too, because when you generate this, like, I almost think about it like the cables under your desk kind of thing. And every guy I feel like goes through a phase of like, oh, I need to like organize my cables and like make them neat. But that's what it was like building this diagram. I was like, oh my God, like all these things in my life. Why do I have this plugged in? And that's a big part of the experience when you're going through it too. But when you work in like a hospital organization, you're just like it's massive. These are like 10,000, 20,000 person organizations. It's hard to understand how it all flows to you, right? You might have your thing and your thing is very big, but it's very small in the grand scheme of just even that organization. And then if you look at like, the region or your state, it's even, a big, just a part of that. And then all across this $5 trillion industry, I think what struck me, and it's always struck me, is kind of the scale of it. I'll kind of do just an aside here. Originally, I tried to write it up like, Carl Sagan's like pale blue dot, like, oh yeah, in this like flow is like, all these claims getting denied. And in this flow is like, where metformin was being prescribed, right? Like, and some of that is true. So you can get really lost in it. And what's nice about it is like a piece of art, like a Rothko or something. The more you look at it, the more things you kind of see.
And I love how you actually took inspiration from an actual piece of art to title this. So do you maybe want to explain a little bit about that? Because I think now that people have seen the diagram, and we'll be drilling back into it in a few seconds, but talk a little bit about the piece of art that inspired you to then name this this creation you have made.
Yeah. So I'm a big fan of when I do like AI generated stuff, I try to like make it like more artistic. I was thinking about different like artists and stuff, and I was inspired by, I think, this scientist, Takel, I don't know if I'm saying that last name right, who did these really detailed scientific drawings of different life forms in like the 1920s and something like that. And I think that's kind of what is representative of it. There's like this organic activity kind of happening in the US healthcare system. People are like, why is it designed so poorly? I feel like it kind of arose organically in a very crude way. And then we also sew it together, almost like this Frankenstein. Maybe it was like Halloween when I wrote it, so I was inspired by that too.
But no, but you're totally correct, because if you look at the more you study the US healthcare system and you look back, and we always should learn lessons from history, as you look back at, well, where does this come from? This piece come from? Where's the legislation behind that piece? Why did that go that way? And if you start to unpick all of those threads, and as you say, I mean, almost like do an autopsy on it, you start to understand the nature of it. So I honestly thought that pen and ink drawing as inspiration for you to then name this your diagram, I thought was inspirational. Do you want to share what that name was?
Oh yeah, an abominable creature. Yeah, which I thought was, yeah, like I said, a little Frankensteinish, but and then the tentacles, right? So it all kind of like flowed together there.
If you'd like to support us a bit more directly, we'd love to have you as a paid subscriber over on the Substack. Or you can buy us a coffee on Ko-Fi to help cover some of the technical costs of keeping this podcast running. Links are in the description. Now, back to the show.
Yeah,
it is fascinating. If you look at one thread, I love some of the insight that you had about the fact that, there's taxpayers is where a big chunk of this starts, but then also individuals and families. And I'm like, but wait, I am both of those things. And so just realizing how much it is we are feeding into the system. And I think if we're just looking at the US here, right? But the rest of the world has other systems that may or may not be better. But looking at the US, we know we have an aging population right now. And it is very scary if you look at this, because we are going to have, as the boomers,
the silver tsunami,
retire. Yeah, it's coming. And Dad, what are you going to do about this? We're going to have to look after you.
I actually, because now that I actually just qualify, sorry, I'll let you get back to your point in a second, Bethany. I just qualify. It's like, actually, I can see I'm going to be okay for maybe 5 to 10 years.
Yeah.
It's what then happens. So I actually think the Gen Xers are in way more trouble than we are, because we're all going to start dying off one way or another because natural lifespan. But, I think that for a lot of people coming down the pike more rapidly, the people that are in their 50s, that's the generation I feel concerned for. I mean, people you and Andrew's age have got time to revolutionize our society and change it and do all the things that we've failed to do for hundreds of years, but never mind. You can live with optimism and aspiration. But I think that's the gap is going to happen, is that the people who have just retired, who've been hit 66 last year, 67 this year, etc., they're all going to be okay for the next little while. And, I've got, 4 more years to hit to 67, 2 more to get to 65. So I don't have to face up to that, and I intend to keep working. So hopefully I won't be relying on Medicare.
Look, my ophthalmologist told me the other month, I went for my annual, get the prescription to get the new glasses. And I was like, well, my granny has macular degeneration. She's like practically blind. He's like, how old is she? It's like, oh, like 95, like in her 90s. And he's like, oh, you're going to have like robot eyes by the time you're 95. It's fine. Don't do anything. You don't need to do anything about it. I was like, oh, okay. So the doctors seem to think that we'll all just have robot parts. We'll be fine. Those will be cheap. Someone will pay for them. It's fine.
Yeah,
somebody.
Fueled by optimism here. And that's, I think you draw a really good kind of point there, because when you look at this like tangled financial flow diagram, right, which in itself could be really boring if I was just like, hey, look at this Excel sheet, right? Like, oh, isn't that interesting, right? Like, it's not interesting. You see yourself in it somewhere. And I see myself as a participant and a recipient in this system. I see myself as a contributor in the system. Like you said, I pay taxes. I got a job, and guess what? My job takes money out of my paycheck to pay for this, right? They got to pay Medicare taxes. They got to pay payroll taxes. They have an employer premium that's tax deductible, so good for them. But that's money that could have went to me instead, but that didn't. Then I got to pay out of my pocket, and I got to pay my taxes. And nothing, by the way, just for anyone listening, I'm not an anti-tax person. What I'm trying to say, though, is that you don't even realize how much you are part of this, feeding into this beast in a lot of ways. And then more importantly, if you work in healthcare and you're selling a solution or you're working with a client, and healthcare is, obviously we know the stats, 20% of GDP, blah, blah, blah. All your customers and clients are recipients of this as well in some form or another. And in a very difficult way, right? I don't know about you guys, but luckily I think this podcast is for insiders. I don't see a lot of my customers lush with money right now. Like, it is tight out there. It is tough. So when you look through this diagram, what are you really learning, right? What are we really seeing here? It's not like some money laundering or some ill intent, or, I mean, there's just a lot of inefficiency I can see for sure.
Absolutely. I think and this is going to be the big contentious statement. So we'll make this one of those viral clips somewhere.
Yeah, let's hot takes.
What people don't realize, and this is what you said in the article, is we already have effectively a socialized medicine system. It's just grossly inefficient in terms of we've dressed it up in all kinds of ways to make it for various political perspectives and so on and so forth over the year. But there's already a huge imbalance between younger people who typically are not consuming healthcare but are contributing a lot to it. And then as you get into your middle and later years, you start to become a bigger consumer of those services. And then as you become elderly, then you become a very big consumer of a lot of those services through the Medicare system. And so the challenge is we've dressed it up in all kinds of ways. We've made money flow in multiple ways. And as you just pointed out, the healthcare industry is in your pockets multiple times, both through direct taxation, through the direct pays that you make in your deductible payments and your out-of-pockets and whatever you're doing with that nice little bit of tax-free cash that you get from your FSA, you're paying all of that money out into the system in addition to your taxes and in addition to this, and so on and so forth. So I think that really was one of the sort of real contentious things, because when you did the comparison with UK and Germany, why don't you talk about that?
Yeah, I mean, I'll throw it out there too. Just, I want to hit on this kind of silver tsunami point we were building towards as well, because I think that's extremely relevant. Well, for one, in the US, every single day, there's 10,000 new Medicare enrollees. 10,000 people are eligible for Medicare. They're turning 65 every day. So that's like 360,000 new Medicare members every year, right? And yeah, they're going to need things like more complex care, long-term care. And I'll tie this back to the point that you just asked about with other countries. Look at Germany. They literally have a tax that goes, nope, this is going right to long-term care. It's very clear and apparent. Everyone, employers and employees, they pay their piece for, their healthcare, their mandatory healthcare contributions. And they know that there's a tax that goes right to long-term care, and that's how they spend it. In the US, it's bizarre. So you have to think about it, right? Imagine if you're a vendor who's like running a nursing home or retirement home or something like that, right? And you're like, Medicaid cuts. What is that? That's not me. What my diagram really shows is that we're all connected. It turns out that Medicaid, like 22% of it, feeds nursing homes, right? So when you hear about this, the One Big Beautiful Bill Act and the Medicaid cuts, you have to know that this is going to impact seniors too. It wasn't just all the work requirements and the undocumented immigrants. It's all connected. And I find it both, I guess, in the way beautiful, because it's like, hey, look, we are all connected. We're all in this together. There's so much of healthcare that's like me versus you. And I know in other countries, it's probably like that too. But at least when I look at other countries, right, like Germany, which we just mentioned, or we looked at how, like, even in the UK, I think they manage a lot of public health very provincially. In the US, it's not like that at all. Like, we've got like,
you're on your own,
taking care of like social determinants or doing some public health stuff. It's very complicated here that we never really figured out.
Yeah, and don't get me started on mental health. I think that, I started my life as a psychiatric nurse, and I was a community psychiatric nurse, out in my little car, going and visiting patients around the community, keeping them supported out there, and, giving them their kind of weekly medication injections to try and keep them stabilized on long term. And that was, something that was handled relatively well there. We know here in the US, mental health care is abysmally funded and organized. And many charities try to fill the gap to be able to, assist there. But I thought the elder care one is interesting because it's those hidden aspects. One of the things, as I was looking at the diagram over the weekend and reflecting on the last month of political activity here in the States, and you had all this argument and debate was if essentially dressed up as opposition to the expiry of the ACA Obama sort of rebates or assistance for healthcare insurance. And when you look at that and you see it as 90 billion in comparison to the entirety of the rest of health. But is there more you'd like? Because I was going to move on to, well, how can people practically use these insights in their tiny little narrow focus of trying to engage with a healthcare abominable creature to look for their commercial opportunities? Do you want to talk a little bit about how you can use this diagram to gain perspective from your perspective, whatever it might be?
I'll tell you right now, and you're right, like aside from this academic stargazing marvel that it is the $5 trillion healthcare system, I mean, that number is incomprehensible, right? I might as well be like, oh, it's the size of Jupiter. And you're like, yeah, Jupiter's huge. I have no idea what that means relative to my life. But, I think a big part of it is being able to see the forest from the trees a little bit. At least practically, that's my advice, is to kind of step back and zoom out and understand what piece you're contributing to and what's the larger thing at hand. I think it doesn't hurt to, stay on top of the news and know a little bit of history. That gives you a lot of credibility in this industry. To your point, though, I know a lot of, at least when I was like a 20-something out of college, I was like, oh, healthcare just hasn't had a smart guy like me fix this. Like if I just got programming to this thing, it would solve it. If I made an app, don't worry, we got this, right?
There is no shortage of hubris in healthcare, believe me.
Exactly. And then it turns out once you like start studying it, the history of it, I think that's a real underrated thing. I mean, Americans generally don't really think too far beyond maybe even a couple decades, but like even thinking beyond a couple decades, you learn a lot about how we all got this way. So anyways, let's get off my pontificating for a second. Practically, if I do understand some of this stuff, I've seen a lot of success in my experience talking to like, I don't know, for example, like a CISO, right? Like a information security officer about like different cyber breaches in other parts of the country and understanding, okay, why is the technical infrastructure built this way? How does the money kind of flow into that? How does that get funded? And what are the reasons for the information flow? That gives me a lot of credibility in those conversations. Or maybe I'm working with a pharma company and I remember we were pushing for getting this cell therapy facility live. And that was really exciting because cell therapy, I won't go too much in the details of that, but it's just like you're taking someone's blood and you're teaching it to fight cancer and then putting it back into the person. So I was working with a bunch of project managers and scientists and they're like, oh yeah, we got to hit these deadlines. And I'm talking to the director and I'm like, no, we got to move this stuff up so that, FDA's come in, we got to get this right. Someone's life is on the line. And it gives you a lot more credibility when you're working with these people who are really mission driven, right? Those are the people who have kind of like made their careers here and they're not trying to make the buck. Those people really are the ones that can make the right decisions, kind of pull the levers to move mountains, garner the like political will to kind of unblock the thing that's in your way. And I think having that macro understanding gives you a lot of empathy to what they're facing and therefore will make you more successful in your career.
Well, it lets you understand, but it also allows you, I mean, a large part of selling or consulting is about establishing credibility. And the truth of the matter is the fastest, easiest way to do that is to be able to, as quickly as you can, demonstrate that you get it. You understand their business perspective. Because if they feel like you're just there to shill your latest, pitch, your toy, whatever it might be, your service, then they'll tune out really quickly. And I've seen it so many times in the flesh, is that you're there and suddenly they've picked up their phone within 15 seconds. And that's it. The meeting's over. Because they're already distracted by whatever the heck it is that is priority not in the top 10 and you are priority number 42. They're just being nice to the department manager that is hosting your meeting. And so I think that, particularly in the provider space, that's why it's important to try and establish that credibility to understand where your solution, your consulting engagement, your value proposition fits against that landscape. And it's not just, I was said to Bethany, one of the things that disappointed me about the health conference is so many of the vendors I interacted with, the people who were manning the booths, so therefore it wasn't typically executives, were just trying to convince me about the features of their widget.
I love that
And I'm
episode, by the
going,
way.
yeah, that's cool. And yeah, there you go. I've got another T-shirt that isn't a Haverin T-shirt from Bluey, and I'm sure your
Oh,
daughter
yeah, I heard about
at
that.
that age. And my favorite character in all of Bluey is Unicorse, and his favorite saying, and he's the puppet that Bandit, the father, uses in the show, and his favorite phrase is, "And why should I care?" And that's really a lot of times when you are making a pitch and you're engaging with any buyer, but particularly in the provider space, is they're like, yeah, they're looking for the so what, but where's the beef?
In America, we say like and subscribe.
In Scotland, we say, don't be a numpty, just press the button.
You know, whatever catchphrase fits your generation, they're really looking for that. CFO Popper was inspired by another Substacker, Trey Rawls, who writes very, very long form analytical type essays. But what he said in that article that inspired my CFO Popper article is that essentially, if you are looking, number one, there's that tiny sliver of discretionary spending that everybody is chasing for as a vendor. But secondly, what the CFO is going to pay attention to is show me how you can replace my spend elsewhere. If you're not displacing a cost I already have and hopefully giving me additional ROI, then I am really not going to pay attention to this. Generating additional revenue, the revenue side, that input side of your diagram is getting really choked these days. The federal government and the commercial insurers they're starting to push it down. So therefore, generating additional revenue is not a surefire area. If you're able to show that you can displace another cost that they've got, then I think that that's something that then starts to get their attention.
That resonates so true to me. Like you said, I've worked with this CTO in this hospital, and we were working on, just like all hospital systems, ebb and flow with IT, this contract renegotiation and like application rationalization. Oh my God, every CIO wants application rationalization, right?
Mm-hmm.
Like, oh yes, get rid of these ops, get rid of shadow IT. So we found this crazy telecom budget that we could like cut, and it would save like $3+ million a year on like, I think it was like 86 million. Let's just call it 100. And we had this great analysis and great recommendation that showed how they can be saving, 6% of OPEX every year and all this stuff. And after going with the CTO on it, he was like, yeah, you know what? Like the nuns won't go for that. And I was like, what? What do you mean? Like, I'm wearing my suit. I feel flashy. I'm like, what do you mean? Like, no, the nuns on the board who are the fiduciary, responsible people for the health system. And not only just like the money, they really need to know about the margin. They need to know, are you creating interruptions of service? Are there going to be any, downstream impacts to kind of ancillary services or outpatient clinics, right? This is, I think, an 11 hospital health system here. And the nuns really do care about those communities, right? So we had to change our deck, like to really emphasize like continuation of service, like how we're going to approach dealing with the go live and the cutover, like the actual rollout plan, the ROI and when they could realize the savings was really the after part of the argument, because in the end, that's not what they wanted to hear. Yeah, they know they need to save money. That's why we were there. But they wanted to know, are you in it to like cash out a quick win, or are you in it to really partner with us and make this thing work?
Well, I think that's exactly the key. What do the people or the person that you're talking to, what motivates them? And that goes back to when I first started in healthcare, I was like a firefighting team, and I would get dropped into a hospital, be like, go fix Dragon for these doctors. Yeah. And I'm like, okay. I'd walk around with my bag, and I would sit with the doctor and they'd be angry. And after sitting with them long enough, they're angry because they are stuck at the hospital after their 12-hour shift, and they can't go to their kids' baseball game because they're still charting. And that's why they're angry, because they're letting down their kid, they're letting down their family. So if I sit with them, whereas before it was like, can I just and then I'd be like, look, if you give me 10 minutes, I can add these words to your vocabulary, your charting will be done, and you will go home. And they'd be like, okay. And I would sit and do it and fix it and sit with them. And then I would go back a month later and they'd be hugging me in the hallways. And they're like, I've made every baseball game. I'm like, yeah, you have. Because it was, what does that person care about? In the big picture, right? What does that person care about?
So there's a sales methodology, and I've written an article about many sales methodologies I've been trained in over my career. But there's one in particular, which was one of the earliest ones I was trained in, which is big and complex and kind of unwieldy to actually use and manage as a sales leader, called Miller-Urroz Strategic Selling. And there's an excellent book on it, and it's been around since the 60s. One of the key characteristics in that is what's called personal wins. Exactly as you say, Bethany. When you are engaging and you're trying to plot a sales strategy and you've mapped out who all the decision makers are of the different categories that Miller-Urroz breaks them down into, you have to, yes, you're looking at all the institutional imperatives, you're looking at the business drivers, what is the value proposition, etc. One of the most important things is, what is the personal win for each decider? Are they looking for a promotion? Are they looking for more time in their life? What is it that is actually important to them selfishly? Them, not the organization. Yes, we all like to sort of say, yeah, it's great, it's this, it's that. Some people, it is just like the nuns on the board earlier on. It's their sense of service and beneficial good to the population they're trying to serve. There truly are people who operate at that level, and that is their driver. And you need to understand that's truly their driver. And it isn't just a motto on the wall of the signage at the front of the building. Other people, it's much more about they're earlier in their career and they're very ambitious. They want a success. Other people looking towards retirement, it can often be, I want zero disruption. I want no upset. I don't want to do anything risky because I don't want to have that blemish in my career. But let me dial this back to the more selfish. We've talked a lot about the provider side. Andrew, talk to me a little bit about lessons that you think are here for the payers, because they're a large part of they're a large part of the industry that, depending on your point of view, either is the oil in the machine that makes all this money flow around, or is the administrative overhead and burden that makes this money not get to the front line quickly enough. And obviously people can take both those perspectives.
Yeah, I think from the payer perspective, and you're right, it is, I think that's the whole point of Frankenstein, right? It's like, oh yeah, you have sympathy for the monster a little bit, and that's really what it is. It's an abominable creature, but you have sympathy for it. And like the payers are a great example too in a lot of ways. I've worked with payers, and you would think because they kind of in a lot of ways control the money flow, right? They collect the premiums and they manage the risk, and the actuaries decide how things get paid out and stuff like that. That they would be like flush with it, but it's actually really, really complicated too. Well, for one, working at like a health plan, you're just subject to a sea of regulatory kind of like the river. You're like a water wheel, and it just doesn't stop. So sales cycles are incredibly long, right? Like we're talking about from like one open enrollment period to the next open enrollment period, right? So AEP, things like that. And it's really funny because like all the product design, all the benefits design happens like months, like in the year in advance. So you might have a whole like 18-month sales cycle before your thing even gets like believed to be folded into one of their products, which then needs to be implemented and then go through like all this marketing, legal, benefit design, all this operations work that takes probably like another whole year because everybody's already preparing for like just this upcoming enrollment cycle. So you're not even going to make a product available to your market until like a year and a half from now. And then after that is when, members and beneficiaries actually start to reap the benefits of that. And the ROI on those things has like a real long tail as well. So like if you're a payer, I've seen a lot of health tech companies kissed a lot of frogs, let's put it that way, where they're like, oh yeah, we'll just sell to like United and Aetna's talk to us.
Mhm.
I'm like, okay, good luck, guys.
and
You're gonna have some
it'll
runway.
all just flow out from there. Yeah,
Yeah, I'm like,
absolutely.
you got to know that what you're up against here, because like I'm sure your idea is great, and I'm sure your
Yeah.
execution can get there, and you're willing to partner up, but you better have the patience to kind of last through these cycles, because that's really what it is. I see as one of the biggest pitfalls,
Well,
right?
and I
Is how
think
people get impatient and they're like, oh my God, how can I just cram in my solution faster?
Mhm.
And that really is one of the things that is a big blocker for success in the healthcare industry.
And this is one of those things whereby there's all kinds of innovation where I've been approached about, a founder, an early stage organization where the concept is I have got this, whatever it is, an app, widget, gadget, whatever it might be, that I know from personal experience because either a parent or somebody I care and love has been afflicted by this. And I've come up with this idea that if we'd just done this, it would have made their lives so much easier. And therefore, they extrapolated it out to, so that would mean they wouldn't need admission to hospital. And the problem is they then say, well, then who can we sell that to? The hospitals aren't going to be interested because hospitals, let's be honest, are really in the business of sickness, not in wellness. That is unfortunately just the case. Their focus is on treating people who are already sick. So therefore, there's lots and lots of the benefit of vaccinations and convincing people to eat. But really, the hospitals are incentivized to treat people who are sick. They go to the insurance companies and say, hey, I've got this great idea there are so many million diabetics in the country. And therefore, this will have this impact and that, and they extrapolate it all out. And what they don't realize is, unless there is an immediate return to the insurance company, to the payer organization, whether it be, a commercial organization or the federal government, they're just going to look at that and go, yeah, sure, that's nice, but it's not going to change my revenue. It's not going to sort of impact how the flow of money is actually going through. The government isn't going to pay me for that. I can't raise my insurance premiums because the politicians are already beating me to death on that. And I've got all these regulations on my head. So even though it's a great idea and on merit societally and impact on a very large population of patients, nothing gets done about it. And the people who come up with those ideas really struggle because what they don't understand is how the abominable creature works.
These value-based care organizations, right? I'm going to take this population of diabetics and make sure that they're getting all of their treatment and their foot checks and their eye checks and their whatever else. And then tick, 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 and then the insurance company will give me money. Well, who owns a lot of those VBC organizations? Private equity.
Mm-hmm.
Here's my hot take.
Bethany says, if you don't subscribe, I'm not allowed to make any more dad jokes.
Which honestly might be a selling point. But still, subscribe anyway, please.
Does private equity give one hoot about someone's health? No. They care about the dollars, which is what, Andrew, your whole diagram is showing. How do I get more of those dollars from the federal government, from these payers to, bump up my investments? And what's sad is I've done so many of these like investment consulting calls with these people, and most of them are willing to learn and listen. And some of them get so just up themselves.
Yeah.
And they're like, well, Epic can just make an integration engine.
Gosh.
Well, the payers can just do interoperability themselves. Why wouldn't they expand to blah, blah, blah? And it's like, okay, let's take some steps back. And so it's interesting to look at your diagram and figure out, where is this money going to? How much of this money, when you get to hospital services or something, right? How much of this is going to clinicians, to staff, to executives, to patients in the form of pharmaceuticals, to executives in pharmaceuticals, to, again, going back to what we were talking about earlier, $4.9 trillion. But at the end of the day, someone, because I was looking at the job postings for my local hospital just this morning, someone is getting paid $22,000 to be a full-time janitor.
Yeah.
From $4.9 trillion. Now, I live in a low cost of living area. $22,000 is still a very, very small amount to live on. You cannot live on that.
Yeah. It's crazy to me how we, I guess, collectively as a society value some of this work too, right? Especially even, I'll just riff off your example, like the janitor. That's really important job too, right? Like,
Yeah.
facility cleanliness.
Florence Nightingale figured out.
Yeah.
Yeah.
It's crazy. I mean, but that's the thing. And that's where I think really the broader theme kind of lies together. And I'm guilty of this, right? I'm a management consultant, right? What do I do? But the whole thing too with this is like everybody thinks they're all separate pieces, right? Like, oh yeah, if I just strip out this part, like private equity, or if I like just bolt on this new like acquisition or something like that, they're not fungible pieces. They're all like together. And even like the small role of like custodial, for like a healthcare organization, right? That's a really critical role. And to see how we kind of commoditize that with really a low rate, it's kind of crazy to think about how collectively we really don't value like proper healthcare, and we value the money behind healthcare a lot more. And then we also spend a lot of money on just overall the system. So it's kind of bizarre how we really have it kind of backwards, right? None of the outcomes related to improving human life are a direct result of all this spending and financial maneuvering.
So 2002, I moved from the UK, where I had spent 10 years working in the NHS and 10 years selling to the NHS, and with various propositions, mostly technology driven, but sort of trying to understand. And I had also spent a period of time not only on the national board of the Royal College of Nursing, so I got access to some of that policy experience very early on in my career, and I got exposed to all of that in terms of that system, which is a very, very administratively lean system. And I moved here to the US. And of course, I had never been a consumer of the US healthcare system. So I arrived and they asked me to choose my benefits, and I didn't. Blah, blah, blah. What became very obvious to me as soon as I started engaging with the system just to get your normal annual healthcare stuff was suddenly how bureaucratic it was. And then the longer I've been here, as I've been through the complexities of my healthcare challenges in the last couple of years, as we've dealt with my sons, as we've dealt with Bethany and the birth of our granddaughter in the middle of COVID, etc., you come to realize how much arbitrage, bullshit, and administrative overhead there is just in playing the game, the dance. Immediately before joining my current employer, I worked for a company called Craneware. They sold ChargeMaster reconciliation software, which is part of the revenue cycle and billing. Enormous industry just in the revenue cycle operations of the provider organizations to do this dance with the payers. So there is so much economic friction in the way that money is going. On the pharmaceuticals, the fact that we've even got a 340B program that needs to be administered to try and make money flow to these underserved communities. And then you have to learn the rules of that game. And then some hospitals are very successful at it and others struggle because it needs to be worked and you need to understand it. And some of the smaller hospitals just don't have the staff to be able to press the buttons to make that system work so the cash can flow to them. So I think that that's one of the biggest challenges I see with the US healthcare system is there is this atherosclerosis in the administrative overhead that is there that just makes it so difficult. And it applies across all sectors. It applies in the payer sector, as you alluded to earlier. They're heavily regulated. They're constantly trying to work on how can they bend the rules, work around the rules, maximize the rules. And you look at the ones who are public companies, and they're pretty successful at it. They're making a heck of a lot of money. On the provider side, they've got this arbitrage they need to dance there. On the R&D and pharma side and the medical innovation side, they have huge overheads with the FDA trying to jump through the hoops there. And then again, as they introduce products in, whether it be new pharmaceuticals, like, we've just had this wave around the GLP-1s, over the last 3-4 years. That's a class of drugs that was like a novelty 4 years ago. a complete novelty. And now you've got people demanding it, and advertisements on TV. Don't get me started on that. That's one of the things that I just don't understand in this country, is the way that the pharma companies
You
can
know,
go direct.
fact about that, you actually spend more time watching ads about pharma companies than spending time with your GP. So
Look, there's a tentacle we can pull out. Let's just make it illegal to have pharmaceutical ads on Instagram and television news, television stations. And then we've just stripped out like a couple $100 million at the very least, probably a lot more than that.
well, yeah, a lot more than that, I'm sure.
Yeah.
Let's just
Well,
pull
there's a
that
call
whole
to
thread out.
action. If our audience would like to let us know,
If
what
you're
do
a
you
federal
think?
policy maker,
If you're here in the United States, what's your opinion about these medication and pharmaceutical adverts that you see on TV for specific drugs? I think, Eli Lilly saying, hey, we're awesome and we're curing cancer. Sure, fine. Everybody's allowed a corporate advert. But if it's a specific targeted drug aimed at trying to influence people to go and ask their doctor for it, what do you think about that kind of advertising? Let us know in the comments, please. But any closing thoughts you've got as you reflect on the diagram and the points we've made, particularly for our audience as they consider, how they grow their knowledge and skills going forward?
Well, it's funny. I enjoyed this conversation too, because I could riff on like the moral pontificating of the healthcare ecosystem all day. And that's what we do, right? Substack, LinkedIn, and things like that. But yeah, I guess maybe the way I like to think about it too, my initial reaction to looking at this massive diagram, I was going to go cheesy and say like, look how we're all connected to each other. I think if I just wrote that would have been truly how I felt, but I don't think it would have gotten across. But really, I think that is true too, because we had this sprawling conversation about everything from like, ads and like IT and ambulatory surgery centers closing and nuns. And it all was related because this is like such a huge amount of our like economy, of our lives, really the beginning, end, and like hopefully we get through a good middle of it with this too. And really all the people that are involved. So maybe the thing I'd like to close with, just as a Pollyanna-ish kind of naive thing to say, is like, try to remember the bigger picture, right? Everything that we're part of, there were decisions that were made in this kind of diagram. Like we all collectively take part in this diagram. We make these decisions. We vote for these representatives. We, patronize these businesses. We, spend our dollars in these places, and we utilize healthcare in ways that we might not even be aware of. So even though that's an unconscious decision, I think it's really important to think about the bigger scope of things and hopefully, make this system a little bit more palatable, make it something that we can kind of overcome and make better, because otherwise it seems a little hopeless. So that's always been my goal, is to make it like clearer, less complex, and hopefully create some optimism that we can get through this.
Absolutely. So I highly encourage all of our listeners and watchers to subscribe to Andrew's Substack for more very, very smart takes on healthcare and just the world that we're living in. I would also highly encourage all of you to like this podcast, to comment, to review, 5-star, all that good stuff. And Dad, is there anything else that you want to add before we sign off?
No, it's been a fascinating thing. And I think for everybody who has an opportunity to reflect on what we've talked about, is maintain your intellectual curiosity. Don't just stay locked in your focused little bubble. Yes, sure, that's very important. We all know that whatever your priority today is, in terms of just whether it's just getting by, or you're looking for your next opportunity, or you're trying to help somebody in your family, whatever it might be, yes, that takes your priority. But open up your mind to understanding more of this business. I talk about horizon scanning a lot, which is you shift your focus from this horizon that's very close to you, the thing that is most important right now, that needs your attention, but then lift your eyes, look to the horizon. But Andrew, thank you very much for joining us. We've thoroughly enjoyed this conversation.
Thank you guys for having me. So glad to meet with you all.
Awesome.
Well, wasn't that fascinating? I told you at the top that it was going to be, and it was. It's almost like I knew these things.
Andrew is such a great guy to chat with. Again, another episode where we could have gone another hour quite easily.
Absolutely. I think what was really interesting to me was just the reinforcement of, yes, you need to know your tool, your product, whatever it is that you're selling, and you need to know your company, and you need to know the place and the space where your company plays. But if you are selling to, whether it's a hospital or an ASC or a clinic or really anywhere in healthcare, you need to understand the broader place that organization sits in, the broader things that their executives are considering and thinking about and having to be aware of. And the more that you can talk about that and truly be a consultative salesperson and not just a, here's my shiny widget, isn't it cool, salesperson, you will be so much more successful in life. And it takes reading people like Andrew and researching and understanding what's going on in the news. What about you, Dad? What did you take away from it?
Well, I think it's back to that thing of, and I've had various sales leaders tell me this in my past, follow the money. And I mean, that's the whole point of drawing attention to Andrew's way of showing and illustrating how the money flows through the healthcare system in the United States and in the two other countries we mentioned, the UK and Germany. If you understand where that money is coming from, and I think it was fascinating to really get to that point, which says we, the American people, who are paying taxes, who are paying for insurance, who are paying for our out-of-pocket, etc., and for all of our co-pays on our drugs and everything else, we are funding all of this. And yet, we are not really the customer. The customer is the elements inside this abominable creature that Andrew described. You know, the payers have way more control. The hospitals have way more control. We, as the consumers of the experience, the healthcare experience, actually have very, very little control over it. And yet, we're financing it, all that money that's flowing in on the left-hand side of that diagram. And so I think understanding that, even though it seems so huge, is really, really important. And then as you are looking at it, as you described from the other lens, looking at what the end of one of those little tendrils looking up, and how do you try and interact with that to be able to sell the value and the proposition of your solution, whether it's a service, whether it's a product, whether it's a technology platform. How are you going to impact that, and how are you going to deliver a true hard cash ROI that is actually going to be impactful? Because that's the fastest way to being able to achieve a sale. I mean, if you've got something that is a soft impact, yes, you can be successful, but it's going to be so much harder, because you're fighting against the mess and mesh of these tentacles of this abominable creature. So no, I thought it was a great conversation to have, and it's all about being educated about the business of healthcare and understanding that. And with that, I would like to thank our visitors for listening. Please like, subscribe. Please visit the Haverin About store and buy yourself some nice merch to support us. We would really appreciate that. But until the next time, keep havering.